everyone. Good morning. Today, I would like to know about oppositional defiant disorder. Um, from the title slide, you could probably guess what this disorder is. Oppositional, which means against, and then defiant. I think we all know what defiant means. So when someone's defiant, he doesn't want to do whatever you say. He's always against it, and it's a disorder. So the disorder when a person is always defiant against somebody. Okay, next slide. Okay, so as I said, the oppositional defiant disorder is a type of behavior disorder. It's mostly diagnosed in childhood. Children with ODD are uncooperative, defiant, and hostile towards peers, parents, teachers, and other authority figures. They are more troubling to others than they are to themselves. They're always against whoever's talking to them. They always feel attacked. Next slide. Okay, so what's the cause of this ODD, this oppositional defiant disorder? As of probably all the disorders that we've talked about, genetics is a possible way of causing this disorder. A child's natural opposition or temperament, and possibly neurobiological differences in the way nerves and the brain function. So his genetics may play a role, and they're just born defiant. There's no specific cause that causes them to be defiant. Just like other people, some people are born and they're always happy and optimistic. There's others that are not so optimistic and are always frustrated. It's just that they have high temperament. It's just it's different from person to person. Another thing that can possibly cause, I think is the main cause of this, is the environment. Depending on the environment he lives in, his parents, how they treat him, his classmates, his friends, the school he's in, the way they treat him, that will have an impact on his brain structure, and it may give signs to him, and the brain may malfunction because of it. Parenting is one of the biggest ones, like lack of supervision, inconsistent or harsh discipline. When there's no discipline on the child, he has low punishment sensitivity. His brain doesn't care. He's not sensitive of any punishment. So he just walks around and does whatever he wants and just is defiant to whoever he talks to, because his brain naturally, it doesn't sense the act. If I do this, if I am defiant, I will not get any punishment, and that's not something that he can personally control. It's the mind of the child himself. Is that clear, or am I talking too much? Good?
Yep.
Yes.
Good. Okay. Biological. Okay, so the environment and biological, it's hand on hand. You could say connected. And correct me if I'm wrong, Mr. Natapon. But what happens is if the environment around him is, let's say, his parents don't have any harsh discipline on him, the neurotransmitters will have a malfunction because of it, and they work hand in hand. And anything that happens, there might be a disorder. The neurotransmitters are in imbalance. The main two neurotransmitters linked to ODD are serotonin and noradrenaline. ODD might also be caused by some amygdala hypoactivity. The amygdala doesn't, as we said yesterday, the amygdala is the part of the brain that's responsible for emotions, and if the amygdala has some hypoactivity, it will not send the correct emotions at the right time. All right, next slide. Symptoms. Sometimes it's difficult to recognize the difference between a strong-willed or emotional child and one with ODD. Children are naturally strong-willed and emotional. And there's a differences to it. There's a strong-willed child and there's a person with ODD. It's two different things. Strong-willed is not a disorder. ODD is a disorder. Strong-willed is just the child himself thinking and being the child that he is, and ODD is the disorder. There's something wrong with his brain. This is a list of there is a list of criteria that people with ODD have, and if he falls under certain criteria for at least 6 months, he will be diagnosed with ODD. The list is on the next slide. Yeah. Okay, so this is, he needs to have an angry or irritable mood for at least 6 months, or an argumentative and defiant behavior for at least 6 months. If he falls under one of these categories for more than 6 months, that is enough to diagnose the child with ODD. Angry, if he's often and easily loses temper, he just gets angry for no reason. Is frequently touchy and easily annoyed by others. Is often angry and other thing that you might need to look out for is he often argues with adults or people in authority. Often actively defies or refuses to comply with adults' requests or rules. He's just defiant. Often deliberately annoys or upsets people. Often blames others for his or her mistakes or misbehavior. A devil of a child, basically. This is, I don't know. He's just a bad child. Next slide. Okay, another symptom of this is vindictiveness. Vindictiveness is the sense of having revenge all the time. He always feels attacked. He always wants to get revenge for no reason. He's often spiteful and vindictive. He needs to show this for at least 6 months in order for him to be diagnosed with ODD. Diagnosis. How will the doctor diagnose him? They will check on his overall health, his blood pressure, things around his body that may give a sign of ODD. Frequency and intensity of behavior. They describe the most likely scenario is the parents describe the behavior to the parent and how often and intense this behavior gets, and based on that, they might diagnose him with ODD. Emotional and behavior across multiple settings and relationships. Again, that probably parts of the parents are going to tell the doctor. Family situations and interactions. How he reacts in certain situations. Strategies that have been helpful or not helpful in managing problem behavior. Presence of other mental health, learning, or communication disorders. So it could possibly bring to another mental disorder, and that's why he's really defiant. Next slide.
I have a question.
Go ahead.
Yeah, like when you say symptoms and diagnosis, like symptoms is before having a disease or disorder, and diagnosis is that what after you have the disorder.
Diagnosis. Diagnosis means they're trying to see if he has the disorder or not. And how can they tell? How can they tell if he has a disorder or not? By the showing of any possible symptoms. You understand what I'm saying?
Oh yeah.
Like if, let's say, the common cold. When you go to the doctor and you're not feeling so well, the first thing that the doctor is going to ask you is, how are you feeling? What's happening to you? He's asking for your symptoms. And based on your symptoms, he will do the diagnosis.
Oh yeah, I understand now.
Okay, good question. Next slide.
Oppositional defiant disorder may lead to complications such as poor school or work performance, antisocial behavior, impulse control problems, substance use disorder, which is drug addiction, and suicidal attempts or suicidal thoughts or even real suicide. Many people already have other mental health disorders such as ADHD, conduct disorder. CD is a mental health disorder diagnosed in childhood or adolescence that presents itself through a repetitive and persistent pattern of behavior in which the basic rights of others or major age-appropriate norms are violated. Uh, Another mental health disorder is depression, anxiety, learning and communication disorder. One of the risk factors is temperament. A child who has temperament that includes difficulty regulating emotions, such as being highly emotionally active situations or having tolerating frustration, parenting issues, a child who experiences abuse or neglect, harsh or inconsistent discipline, or a lack of parental supervision is at risk of ODD. Other family issues, as we talked about this a lot, that most mental health disorders are inherited, and environment. ODD is reinforced through attention from peers and inconsistent discipline from authority figures such as teachers. First treatment is parent training. A mental health professional may teach the parent some skills to treat their child with more consistent, positive, and less frustrating. And parent-child interaction therapy, or PCIT. In this therapy, a therapist coaches parents while they interact with their child. Social skill training, teaching children how to be more flexible and learn how to interact more positively and effectively with peers may also benefit. Individual therapy, it will help the child to learn how to manage anger and express feeling in a healthier way. Family therapy, it helps the family work together and increase the relationship and communication between them. Cognitive problem solving training, this type of therapy is aimed at helping the child to identify and change thought patterns that lead to behavior problems, and collaborative problem solving, in which the parent and the child work together to come up with solutions that work for both of them. There is no guaranteed way to prevent oppositional defiant disorder. However, positive parenting and early treatment can help improve behavior and prevent the solution from getting worse. The earlier that ODD can be managed, the better. Treatment can help restore a child's self-esteem and rebuild a positive relationship between you and your child's relationship with other important adults in his or her life, such as teachers and care providers, also will benefit from early treatment. Here is the end of the presentation. Thanks for your attention.